Good morning, everyone. This is Christina Wade. I serve as Health Programs Manager for Delta Regional Authority. It's 11 o'clock, so we're going to go ahead and get started here. I know you're all busy. First, I'd like to thank everyone for joining us as we discuss the Delta Wellness Mission, an innovative readiness training opportunity that we host in partnership with our military forces and, of course, our community partners. Again, I'd just like to thank you all for joining us, and we're really excited about hosting this mission this year. I want to go ahead and introduce to you Brian Henson. He serves as the Chief of Staff for our agency, and Brian's going to provide a brief overview about DRA and talk a little bit about why we invest in the health of the residents within our footprints. Brian?
Thanks, Christina. I appreciate everybody being on today, and I will be brief. I'm going to give a quick 100,000 foot overview of Delta Regional Authority, kind of who we are, area that we cover, how we're governed, and then why we focus on healthcare. As you'll see on your screen, DRA was created in 2000. We make strategic investments, federal appropriations into four main bucket areas, those being basic public infrastructure, transportation improvements around economic development sites, workforce training, and small business development. We support economic development and job creation through a variety of different approaches, that being fostering local and regional leadership, training workers in demand careers, we say industry driven skills, and diversifying opportunities for small business and entrepreneurs. We also, one thing that you may see here is that healthcare is not necessarily one of our four bucket areas, but it's intertwined in each of those areas. Infrastructure, clean drinking water has a healthcare aspect. Transportation improvements, having access to get to the medical clinics, uh, all of those factors. Also, with workforce training, we spend a lot of time workforce training in our region, but what good is it to train the workers if the workforce is not healthy? You have a lot of missed man hour days. So, not only do we want to train the mental aspect of the workforce, but also the health aspect. So this is some of the reasons why we focus so heavily and partner with our federal partners such as Department of Defense to bring these type of programs to the areas. I think Mandy, you can move ahead. Just wanted to give you a little map. Some people ask, what is the DRA area? Well, you'll see we start in the southern tip of Illinois and flow all the way down to the Gulf of Mexico along each side of the Mississippi River. Touch 8 states. They be in Illinois, Missouri, Kentucky, Tennessee, Arkansas, Louisiana, Mississippi, and Alabama. Um, some people ask me, how did we get the two spots in Alabama? I don't know. It's the way it was drawn in. But we do work heavily in Alabama as well. You can move ahead, Mandy. DRA is governed by a federal co-chairperson and an alternate federal co-chairperson that are appointed by the president, and the federal co-chairperson is also has to be confirmed by the Senate. But also, we are governed by the 8 governors of each of the states that involve our region. You'll see a list on your screen of the current governors of the Delta Regional Authority. Work very closely with their staffs and working on projects, initiatives, focus areas for each of our 8 states. As I mentioned just a few minutes ago, the reason why we focus on healthcare in the Delta is we know that not only do we have to train the workers, but keep them healthy, but we also know that in a lot of our rural communities, the hospitals are one of the number one or number two job creator in those communities. If they shut down or go away, then you not only have a health disparity, but you also have an economic issue in those areas. So we try to focus on programs like this, working with DoD to help bring healthcare to the areas. But we also work with other partners such as Health Resources Services Administration to do technical assistance for some of these rural hospitals to help them understand how to better align themselves financially and also provide increased services to their community so that they continue to thrive and contribute to the overall aspects of the community. I think it's very important that we focus on this because, it also is one of the aspects that companies look at when they come to locate in an area. Quality of life is one of the major aspects that they look at. And without a healthcare, that puts the community without, if they don't have a hospital or a clinic, it puts them kind of behind the curve on that quality of life aspect when the companies are looking to locate there. So I've kind of given you a real quick 100,000-foot level of the agency, what we do, the areas that we focus in, why we focus on healthcare. I want to kick it back over to Christina Wade, who is our program manager for all of our healthcare programs, does a great job, works very hard on the IRT, works very closely with the Department of Defense and the communities. I appreciate her efforts and time. We have others from our staff that also play a very critical role in helping get the messaging out for IRTs and helping facilitate. And I know they will be talking to you a little later. So I won't keep talking. I'll let Christina, the person you really came to listen to, let her talk and give you all the detailed information that you need. Go ahead, Christina.
Thank you, Brian. Mandy, you can move to the next slide. So let's look at what healthcare looks like in our footprint. As Brian mentioned earlier, we serve 252 counties and parishes. And of those 252 counties and parishes, 241 of those are deemed as a health professional shortage area, which means we have a shortage of primary medical care, dental, and mental health care providers. Also, 244 of those counties and parishes are deemed as medically underserved areas, which means we have, again, few primary care providers, high infant mortality rate, high poverty rate, and a high elderly population. Next slide. So this means for every one physician, there are 2,311 patients to see. Next slide. So on a scale of 0 to 26, in terms of health professional shortage area, our footprint ranks at a 17 in terms of the dental health professional shortage area and 19 in terms of the mental health professional shortage area. Next slide. Again, what this means is there are 2,372 patients for every one physician. Next slide. So again, as Brian said, we're committed to promoting a healthy Delta, and we do this through our health initiatives, one of which is the Innovative Readiness Training. So through a partnership with the U.S. Department of Defense and the U.S. Reserve Forces, DRA supports IRTs and Delta communities each year to bring no-cost medical, dental, and vision care to residents. And it also improves military readiness by providing trained military medical personnel with in-field emergency response training. Next slide. So a little bit of background about IRTs. They are exclusive to the United States and its territories. They provide key services with lasting benefits for our communities. So not only are there healthcare IRTs, but there are construction, transportation, and cybersecurity IRTs. IRTs deliver joint training opportunities for military personnel, and they've been around since about 1992. Next slide. So the IRT that we'll focus on this year is the Delta Wellness Mission. It will take place July 6th through July 20th of this year. And the locations are Lake Village, Arkansas, Lake Providence, Louisiana, and Greenville, Mississippi. And if you see the map here, the little blue dots will show where we've hosted missions since 2009. So we've been doing this for a very long time. Next slide. So what are the benefits to the community? What will the Delta Wellness Mission bring? No cost dental exams, no cost dental fillings, dental extractions, no cost vision exams, single lens eyeglasses will be made on site and provided to the residents. Basic medical services, vital checks, sports physicals for the kids if they need them, nutrition and wellness consultations, physical therapy, and really, which is so important, access to local resources for continuity of care. Next slide. So here's some numbers on submissions that we've hosted in the past. In 2018, we hosted missions in Alabama and Illinois. As you can see, 809 glasses were distributed, 1,066 teeth extracted, and this created a $1 million benefit to the community. Next slide. In 2017, we hosted 3 separate missions in Missouri, Louisiana, and Arkansas. Mission outcomes here, 25,600 patient visits, 3,600 glasses were fabricated, and 4,100 teeth were pulled. Next slide. So lastly, in 2016, we again hosted 3 separate missions, Natchez, Mississippi, Western Kentucky, and West Memphis, Arkansas, 14,099 patient visits, over 4,400 glasses fabricated, with a $4.4 million benefit to the community. Next slide. So what are the benefits to service members? As you can see here, we'll just say that 82% reported experiencing training that mimicked deployment conditions, 79% reported feeling better prepared for deployment after participating in an IRT, and 88% reported having trained in leadership skills that they otherwise would have not been able to under typical unit training events. Next slide. So Delta Wellness Mission 2021, back in 2018, we were thinking of ways to create a mission that would increase the size and the scope of missions for the military while also providing benefits to our residents. We looked at several communities and we thought that Greenville, Lake Village, and Lake Providence, Louisiana would be a challenge to the military while also, again, providing benefits to our footprint. Next slide. So here are the proposed locations. Next slide. Patient eligibility. So our military partners will see patients ages 3 and up. There are no income requirements, no insurance requirements. Everyone's welcome. So they won't ask, do you have private insurance, or do you have Medicaid or Medicare, or how much income? None of those questions will be asked. Everyone is welcome to receive services at the mission, 3 and up, of course. Next slide. So let's talk about COVID. Of course, we want to keep our residents safe. We want to keep our military personnel safe. So we have worked diligently on making sure in the military that our COVID risks are at a minimal. Next slide. So what will we do? Patients that come to the mission will take their temperatures will be taken before they enter the facility, and they'll have to answer, a verbal questionnaire. Military screening. The military will be screened on a daily basis. They'll have their temperature checked, and they'll also have to answer the daily verbal questionnaire. Next slide. Face masks will be required for military and patients. If a resident shows up without a face mask will be provided. There will be social distancing and waiting areas. Of course, everyone will be seated 6 feet apart as they wait for services, and we'll have hand sanitizers at the entry and exit points. Next slide. Clinic procedures. So there will be 1 dental chair or 1 patient per room. Optometry chairs will be 6 feet apart and or separated by partitions. There'll be a daily cleaning of the facility during the mission, and at mission completion, there will be a terminal cleaning, which means all surfaces will be disinfected. Next slide. For military personnel, bed down procedures, the cots will be 6 feet apart. There will be head to toe sleeping, and there will be a curfew imposed. Next slide. So we won't go through this entire risk assessment plan, but our partners have created this very detailed plan. It shows each activity, it identifies the potential hazard and it scores the hazard. And you'll see that they implemented controls and they've rescored the hazard. So we take COVID very seriously, and we want to make sure that our military personnel, that they're safe and the residents are safe. So Mandy, you can just flow through these slides. Just kind of wanted to share with you the work that was put into developing this COVID-19 risk assessment plan. Go ahead, Mandy. So at this point, we'll move right into community engagement and partnership opportunities. We cannot host these missions without the community. The communities that we have visited have been very accommodating. Mayor Yee and Lake Village, Arkansas, the superintendents of the schools that we have visited, everyone's been so accommodating. And again, we cannot host these missions without the support of the community. Next slide, please. So areas of opportunity to partnership. We look to the chambers and the local businesses and the civic organizations again to showcase the community to the troops when they come to serve. So we often like to have a welcome packet for them, kind of share a little bit about the community, have a list of places of worship and restaurants. Maybe if the restaurants would like to provide some coupons or discounted entry to the sports facilities. We just like to make them feel welcome and provide a welcome packet to them as they begin the mission. So during the mission, if you could go back one slide, Mandy. So during the mission, the patients have to wait. Sometimes they wait for hours to receive care. So as they wait, we like to provide them with bottled water and maybe snacks. And if they bring their children, some books so that the children will be occupied while they wait for services. Next slide. Our faith-based community and our civic organizations often like to provide hot lunches for the military. Now the military, they bring a kitchen staff and they are prepared to cook breakfast and dinner. And usually for lunch, they have cold sandwiches, bag lunches. So our community partners have been really good with providing hot meals for the troops as they serve, and an occasional dinner. Marketing efforts of the Delta Wellness Mission. We again rely on the community to help us get the word out about the mission. So just sharing of information on social media and sharing of information inside. Next slide. Hospitals and healthcare facilities. So we look to our partners to help us with waste disposal. Of course, there will be sharps in the dental unit, in red bags and some amalgam. So we look to our hospitals and healthcare facilities to assist us in the proper disposal of the sharps and the red bags during the mission. A key element of the mission is the resource center. So as the patients or as the residents exit the facility, we want to be sure that they're connected with aftercare resources. This is one of the most important parts of the mission. We like to make sure that they're provided with information regarding services after the military leaves. Also, we want to make sure that the hospitals, of course, are aware that we're hosting the mission, because if there is a patient who maybe comes in and blood pressure is severely elevated, or we have an issue where we need to call the ER, we just want to make sure that the hospital is aware that, yes, this mission's going on and we have a patient coming from the IRT. And of course, again, marketing of the Delta Wellness Mission, we look to the hospitals and the healthcare facilities to assist in marketing the mission. Next slide. Community action and social service agencies. So again, there will be a resource center as the patients exit the building. And for any organization that would like to provide information regarding their programs, energy assistance, rental assistance, workforce programs, that will allow you the opportunity to do that in hopes that patients who don't know about the services provided by these agencies in the hospitals and the healthcare departments will leave with some additional information so that they can continue to receive care after the mission is over. And of course, again, assisting us in marketing the Delta Wellness mission. Next slide. I want to introduce you to Shauna Blair. She's the Director of Communications and Public Engagement for the agency. She's going to talk a little bit about communications and public engagement. Shauna.
Thank you, Christina, and good morning, everyone. Again, as Christina said, my name is Shauna Blair, and I'm the Director of Communications and Public Engagement for the Delta Regional Authority. So as you all know, a strong communications plan is essential for any successful mission. And we work closely with our partners at the U.S. Department of Defense and the IRT mission personnel to mandate that all language is approved before distribution, just to make sure that our messages are both communicated accurately and also are sensitive to those that are receiving treatment. For instance, people may say that this mission provides free healthcare, but that's not entirely accurate. The way that we say it is that it provides healthcare at no cost to the patient. So there are little phrases like that at first glance may mean the same thing, but we want to make sure that we're very accurately stating our message the way it should be. So that said, DRA in collaboration with the DoD IRT mission personnel will be crafting all external messaging. However, as Christina mentioned, we still will need to rely on our community partners to help us spread the word about the mission. And so we want to encourage you to share our messaging. Next slide, please, Mandy. So this can be done by following DRA and IRT on Facebook, Twitter, LinkedIn, and Instagram. These are our both DRA and IRT's handles below. IRT's is a little bit easier than ours because every single one is IRT's win, where ours is a little bit different throughout all of our social media platforms. We have these social media handles listed, but you can also email me at sblair@dra.gov for these, or if you have any questions following this webinar today. In terms of media or press access or any interest before or during the events, all media access and inquiries will go through me and go through DRA. So if you do receive any media requests or inquiries, or if you have partners within media organizations in your town, in your areas that you think that would be interested, please pass them along to me so I can work with them to make sure that the missions are covered accurately and timely. And this is all the information for right now, but further information, including, much more details about this, will be provided at a later date. I just wanted to give a quick overview, and I wanted to thank you guys for being on today and taking a listen to us.
Thank you, Shauna. Next slide, please, Mandy. So we're going to move right into Q&A. We do have Captain Patricia Gould with the U.S. Air Force with us. She's the IRT, she's the Air National Guard IRT Program Manager. I know this has been a lot of information to consume in the 20 minutes that we went through our slide deck. So if you have a question and you prefer to email me, feel free to do so. But I would like to open the floor to any questions that you might have.
Hey, this is William Bridewell. I'm with the Arkansas Rural Health Partnership in Lake Village. We would be interested in doing a little community support when the mission comes. About how many troops would we be expecting at the high school here?
Captain Gould, can you speak to the number of troops that will be at each site?
Good morning, everyone. Thank you for inviting me. For this mission right now, we are at 320 for all 3 sites, and we're planning to have anywhere from 75 to about 120 at the Lake Village site.
Okay, thank you.
Thank you, William. We look forward to partnering with you on the mission. Does anyone else have any questions? I do know that there's one thing I didn't cover, and mission hours have not been established, but I'll let you all know that typically, or on past missions, mission hours have been Monday through Friday. We usually start at 8 and end at 5. And on the weekends, we kind of have shorter hours. On Saturday, we'll have a later start and an earlier finish. And on Sundays, we usually do a short day, about 1 to 5. So those have been the mission hours in the past. And of course, we work with the community to set those hours moving forward. Any other questions?
Yes, Christina, William Gillison, how long will the mission be here in Lake Village? What's the length?
So the mission date is, the date's July the 6th through the 20th. Typically, the first couple days are set up and the last couple days are set down. So take down, sorry. We're looking at a 9-day, about a 9 to 10 day clinic. But the troops will be on the ground from July 6th through July the 20th.
Thank you.
Thank you.
Hello.
Yes.
This is Shalisa Presley. I'm sorry. I'm getting on a little late, little technology problem. But for community partners, are y'all allowing them to come and set up? I worked with the team before when they came about 4 years ago.
Okay.
So are you still allowing community partners to come in and set up and provide information about different things going on in the community?
Absolutely. And I can send you this presentation and we can have a conversation offline to kind of go through what we discussed. But yes, absolutely. What we'll do, folks that are interested in participating in the Community Resource Center, you just shoot me an email. I will get back with you. And then we start to have these bi-weekly calls to kind of coordinate everything. So we'll do this until mission execution. Just so everyone's on the same page. We'll all know who's in the resource center. We'll all be socially distanced. So that will happen. And again, we can chat in more detail, and I can send you some information. Thanks so much, Ms. Presley. Captain Gould, we have a question on the floor in regards to the number of troops that will be in Greenville. I think we covered basic Saturday hours. Can you go over that one more time for us for each site, if that's okay?
Sure, ma'am. Okay, we're expecting about 75 to 120 at Greenville and Lake Village. And at Lake Providence, because of the size of the school, we'll try to keep it below 80.
Thank you, Captain Gould. And while folks kind of generate questions, I know there are a lot of questions on the floor. Again, feel free to email me. Captain Gould, is there anything that you would like to add in regards to the mission, something that maybe we did not mention?
I think you did a really great job, Ms. Wade. But we're really excited. The members are, because this is one of our first, well, no, this will be our third mission post-COVID. So we are paying close attention to the guidelines and the restrictions, and just to be able to work with the community. All the members are, because it provides training for us, but it also builds esprit de corps within the troops, which is something we always encourage. And it's an opportunity to partner with the community. And it's always good to do missions at home. So we're really excited about working with you all.
Thank you, Captain Gould. Mary Yee, are you still on?
Yes, I am.
Mary Yee, we've worked with Mary Yee on this mission since we submitted the application, and just want to briefly, Mary Yee, if you could talk about your experience so far with DRA and the troops, and your thoughts on the mission.
Let me just say, I want to thank DAR and the mission for selecting Lake Village as one of the sites to host this in. And I'm telling you right now, the people in this community are excited. We can't thank y'all enough. I think that the mission group that came to Lake Village for 3 days and had the training, it was very successful. And I just can't thank y'all enough, Christina. We're just waiting for the day.
We are excited as well, Mary Yee. Thank you so much for being accommodating when we come to Lake Village.
It was our pleasure.
Thank you. William has a question. William Bridewell. He wants to know if a community organization wants to provide lunch on a particular day, who will we need to coordinate with? William, you would just send me an email and we'll have a conversation, and we'll work together to make that happen. And again, we'll start having bi-weekly calls in May, and we'll have a schedule. Folks will know who's bringing what, who's doing what, so we won't have an overlap. So we're pretty organized in terms of who's coordinating lunch, who might be doing dinner. But again, we appreciate the community support. We really do. Anyone else have any questions? If not, we'll go ahead and close. Again, we thank you so much for joining us today to talk about the Delta Wellness Mission. We're excited about the mission. It's such a benefit to the community. We see a direct impact. So again, if you have any questions, feel free to send me an email, and we can definitely chat. Thank you, Captain Gould. Thank everyone for joining us, and just look for additional information in regards to our bi-weekly calls. Have a great day.